so many times what I see as a chiropractor and in clinical practice is I see that patients come in and they've been diagnosed with carpal tunnel, and oftentimes they're scheduled for surgery, or they've even been through an unsuccessful carpal tunnel surgery. What I find is that maybe they did have carpal tunnel, and maybe they had what's called a double crush syndrome, which is potentially where the carpal tunnel nerve, or the nerve that goes through the carpal tunnel, is actually being impinged in multiple locations. So it may be being impinged in the carpal tunnel, but also in the forearm, the elbow, the shoulder, and potentially even the neck. Every release is going to be beneficial for that, and oftentimes these releases, they don't need to be surgical. So we've been able to keep many patients out of the operating room just by identifying this potential double crush syndrome and identifying all of the potential places where the median nerve can be entrapped. Whenever someone asks me, should I get the surgery, I say, well, why don't we keep it scheduled, but ask the doctor if he'd be willing to push it out a little bit so that we can try a more natural approach, because the ramifications and the healing time are really long, and they often aren't always the best outcome. So if we're able to get the body to do it naturally, obviously it makes sense to do that. It's a fraction of the cost, and it's a fraction of the healing time, and oftentimes with a much better result.